So in this video we are going to talk about special tests for the cervical spine. Now there are so many special tests for the cervical spine, but today we are going to focus on strength. So we are going to discuss about two tests: craniocervical flexion test and deep neck flexor endurance test. Just two. Now before picking up any special test, examiner should consider that a special test has a good reliability, validity, sensitivity, specificity and odds ratio. Now let me explain a little bit and then I'll move forward. So what is reliability? Reliability is a scale will give you the consistent results. For an example, if I go and check my body weight on a weighing scale, the scale will show me certain pounds. After 2-3 hours I go and check, it will give me it should give me the same results, right? So reliability is a scale should give you a consistent results. Second is validity. Validity is ability for any scale to measure what it is intended to measure. Like if I go and check my weight on a weighing scale, it should give me my weight, nothing else, right? Sensitivity. Sensitivity is the ability of a scale to designate that a patient or a person has a particular disease or a patient does have a problem. That is sensitivity. Specificity. So specificity is ability of a scale or to designate that a person or a patient should not or must not have a particular problem or a disease. And last but not least is the odds ratio. So odds ratio is the association between the exposure and the outcome. Now, as I said, so cervical spine, if you divide the special test in a strata, so first is strength, so that we are going to talk about today. So strength is craniocervical flexion test and deep neck flexor endurance test. Some tests will check the neurological symptoms. For an example, distraction test or ULTT, upper limb tension test. Some tests will check the myelopathy. For an example, Romberg test. Some tests will check the vascular signs like VBI, vertebrobasilar insufficiency test. Some cervical tests are for instability, like all the ligament stress test for the cervical spine. Some tests will check the mobility, and then the mobility tests are again divided into first rib mobility and a cervical spine mobility test. Now, special test. So when an examiner finds picks the relevant test and perform, that will confirm the diagnosis. For cervical spine, if the examiner is checking the upper cervical spine, examiner should always check the instability test and vascular vertebral artery test. Now, if you see, some tests are provocative in nature, will reproduce the symptoms again, and some special tests will relieve the symptoms. But again, the result from a special test will solely depend on the experience of the examiner or the skill of an examiner, how an examiner performs. So this was all the background. Now we'll move to our topic. As I said, the special test for the cervical strength or cervical spine strength. The first is cervicocranial flexion test. So in that, patient is in a crook lying position. Patient is in a supine and crook lying with the hip and knees flexed. Towel must be used to keep the head and neck in neutral or mid-range position. For this test, a pneumatic device should be required or must be required. It's a pneumatic device where you feel the pressure up to 20 mm of Hg, 20 millimeter of mercury. Now, this test should be checked in 5 different stages. At 5 different stages where you check the test at 22, 24, 26, 28 and 30 mm of Hg. So you keep on increasing 2 mm of Hg of pressure. Now check that if the patient can hold the contraction at particular pressure for 10 seconds. Give the rest 10 seconds to the patient between each segment you check. Okay. Now make sure that the patient don't use the accessory muscles or patient don't trick the movement, like patient should not use or must not use the sternocleidomastoid, platysma, or even the hyoid muscles. Now, when you say the test is positive, that if the patient cannot hold the pressure in that pneumatic device where the patient can see, that patient cannot hold for 26 mm of Hg and patient cannot hold the contraction for 10 seconds, that means the craniocervical flexion test for that patient is positive. Now there is something called as a performance index. So performance index is increase in pressure times the number of hold a patient can perform. Now activation score is maximum amount of pressure patient can reach and hold that for 10 seconds. That means this can be the activation score for that particular patient. Now we'll move to the next. Next is deep neck flexor endurance test. This both test, the craniocervical flexion test and deep neck flexor endurance test, will check the function of deep neck flexors. So in this deep neck flexor endurance test, the patient is in same crook-like position. Ask the patient to retract the cervical spine as much as he or she can, and then maintaining that retraction, go for nodding movement or go for cervical flexion. How much? 2 to 5 centimeter from the examining table or just 1 inch above the examining table, and hold that contraction. So examiner places the hand underneath the patient's occiput or head. Now, what can be the ranges? So a normal person can hold that contraction for 39 seconds plus or minus 26 seconds. And all the patients who have neck pain will averages around 24 seconds somewhere. Thank you. In my coming video, we are going to talk more about the tests that check the neurological symptoms on a cervical spine.